Recent published data from the United States showed that more than half of symptomatic severe aortic stenosis patients who have a clear indication for aortic valve replacement, are not getting treated.
This data is quite alarming because if these patients don't get their valves treated, their disease will continue to progress and get worse until ultimately their hearts may fail. And the benefits of aortic valve replacement are clear, not only on survival but also on quality of life.
While we know that aortic valve replacement is life-saving, this study found that symptomatic severe AS patients over 80 received valve replacement significantly less than patients in their 70s. This is unfortunate because we know if we don't treat symptomatic severe AS, as few as 50% will survive 2 years after the onset of symptoms. In my opinion, age should not be the only consideration. Since TAVR has proven to be a valid option for this patient population, regardless of their surgical risk level. We recently treated a patient in her late 80s who came in with heart failure. During that hospitalization, we discovered that she had been previously diagnosed with severe aortic stenosis and experiencing symptoms for more than a year. But rather than pursuing treatment, she was instead advised to take it easy and slow down her physical activity. But this patient had a lot of life left. She was previously healthy and wanted to be able to get back to the activities she loved to do. So we ended up replacing her aortic valve with a TAVR, and this really improved her quality of life. She was able to get back to gardening and walking her dog, and she told us that she wished she got her valve replaced much earlier.
Aside from age, comorbidities may lead physicians to hesitate to refer their patients to a valve specialist. But for patients with some comorbidities or past cancer histories, there is evidence that AVR can improve symptoms and even survival outcomes versus conservative management. This is why it's important to send severe aortic stenosis patients for an evaluation. So for any patient who comes into my practice with severe AS, we immediately start to think, how are we going to treat this patient? Whether it's surgical aortic valve replacement or TAVR. I work with the heart team to help the patient make that decision, based not only on their surgical risk, but also their preference.
Referring cardiologists know their patients very well, so we count on partnering with them to determine which approach is best for their patients.
My role as the cardiologist is to educate the patient and their family about what happens if they don't get treated. And ultimately, when I do refer them to the heart team, I try to prepare them for what to expect.
If a patient has severe AS, I would encourage their cardiologist to refer them directly to a comprehensive valve center so the heart team can collaborate with them to find the best treatment option for their patient.